increase insulin sensitivity and lose weight?
Okay, so this is a great question. Someone's asking about chiroinositol. Have you guys heard of that before? Inositol is a great blood sugar regulator, and it's actually in my hormone helper if any of you have tried that. But it's there on purpose. It's there to regulate insulin levels and keep blood sugar nice and stable. Now, the dose of inositol for both men's health and women's health is similar. It's about 1 gram a day. Sometimes we'll go up to 1 gram twice a day. Because remember, with inositol, we're trying to manage insulin, keep blood sugar stable to prevent estrogen dominance or storage and accumulation of estrogen in body fat. And the more estrogen dominance men have is going to lower their testosterone levels, right? And the more estrogen dominance women have, they're going to have more visceral fat, more symptoms of high estrogen, which include migraines, fibroids, bloating, feeling tired all the time, and so much more. So hopefully that answers that particular question.
And on TikTok, we have a recurring question about cosmetic procedures.
Okay.
Let's see. So we have one that says, what are your thoughts about cosmetic procedures for weight loss?
Cosmetic procedures for weight loss. Okay, here's the challenge with cosmetic procedures. They are a great fix after you have the foundation, right? So you can go and do a cosmetic procedure for weight loss. There's so much out there, right? There's Sculptra. I think my esthetician was telling me about the Venus. Like, there are all these machines out there. Actually, that would be a great video to do, is to examine all of them. And then there's the big stuff, right? Like bariatric surgery and liposuction and so much more. Here's the problem. If you don't have the foundation for weight loss, like if you're not doing the right things in terms of eating in a particular way, exercising and moving, no matter what procedure you do, that fat will reaccumulate. And because of our genetics, it's probably going to reaccumulate the way your body is used to having it reaccumulate. So for me, it's always down here. For somebody else, it's in the belly. For others, it may be in the breast, but it's going to go right back to doing what it's used to doing. So the advantage of those procedures, I think, are for someone who's really done the work. They've tried their hardest, and this is kind of like their last step to take them over the line in terms of what they're trying to accomplish. So that's how I would think about it for sure. I hope that helps.
Someone said, when doctor says a patient isn't brain dead but is on the verge of it, what is the likelihood they will wake up from a coma?
Ooh, I don't know if I can answer that one. This is a question about people in a coma and their chances and likelihood of waking back up. We don't have data on that. I don't think, I mean, again, there's the hard data that's very negative, right? But I think that none of us know what's going on a different dimension there, so I don't know if I can answer that necessarily. I'm certainly not equipped to answer that or educated enough to answer that, so I'm gonna have to pass on that question. But, you know, I would say you never know what's gonna happen, and things can, there are miracles and things do take place that there are no explanations for sometimes.
We have a comment, I think it would be nice to address. Someone mentioned about Tylenol. They made the statement that Tylenol actually stops baby lungs from working.
Okay, so that's an extreme statement about Tylenol. Someone saying Tylenol stops babies' lungs from working. I think that statement is a little bit extreme. Again, we've got to go back to what we know and how medications work and what's happening there. Here's what we know. Tylenol does act on the liver. We never want to overdo these medications, right? I think the problem here is so many people are used to taking a Benadryl or a Tylenol or a Motrin every day for a particular symptom. That's when you're really weighing the liver down. If you have a one-off dose of something that you have to take, that's not the problem so much. But it's the daily use, the repetitive use in a given day or week that really is more of the problem. So Tylenol stopping babies' lungs, I haven't heard of before, but definitely interesting that we're connecting Tylenol now to autism.
There's another question. Why do our ovaries ache during perimenopause?
Okay, so this question is about ovarian pain during perimenopause, and it's an important one because if you are feeling more ovarian pain during perimenopause, there's a chance that you may have developed fibroids or cysts, and that's the reason that you're experiencing more pain. Perimenopause is a prime time. Everyone thinks that ovarian cyst is a issue of your teens and your 20s. Is simply not true. Because you're having hormone shifts as you get into perimenopause and menopause, then we know that that is a prime time to develop things like ovarian cysts, fibroids, and even have thickened endometrial linings that in turn give you a lot more pain. So if you are having ovarian pain, I do recommend, one of the things I keep seeing over and over again in practice is that women are not routinely getting pelvic ultrasounds. I do think you need a pelvic ultrasound at least once a year, because that in turn is going to help to identify, making sure nothing's going wrong with any of your internal organs, you don't have cysts or fibroids or thickened endometrial linings that are going to catch you by surprise later on.
There's another question. How often should we implement a detox for gut health, and what are the symptoms that you need a detox?
Okay, a question about detoxing for gut health. And for those of you who have not joined my Superwoman Circle, we're doing a deep dive into gut health in literally the next 10 minutes. So you still have time to go on there and join the circle and get the Zoom link. Remember, in my Superwoman Circle, we do monthly coaching sessions, we do webinars, you guys get guides and recipes and all kinds of great goodies. And it's just a really fun community that's come together and supporting one another. And those women are learning from each other. Sometimes they don't even need me. It's kind of fun to watch. In fact, we had a session where our power went off at home and they were all talking and interacting with each other and sharing tips. But the question about detoxing for gut health. So again, in the Superwoman Circle, you'll have access to my 3-day belly fix. It is also on my website, drtass.com, where you can download it for yourself. But that is all about a mini quick way of detoxing the gut, taking out the inflammatory foods, rebuilding that gut lining. There's a longer version of all of that in my book, The 21-Day Belly Fix, which is broken out into weeks. You could do week 1 of the 21-Day Belly Fix plan. You could do 2 weeks of the 21-Day Belly Fix plan. You could do the entire plan. But all of that has been written to help you reset and rebuild your gut and help to remove the things that drive a dirty liver and trigger inflammation.
And this question is on TikTok. How can I go about finding a doctor that examines the whole person? Florida doctors aren't doing the trick.
Well, you can always come see us at Center Spring. It's about finding doctors. So usually your integrative functional doctors are thinking about the whole person, right? We're not, in fact, I'm training one of our newer nurse practitioners, and she was like, I was just trained to refer, like do this and refer this out. We are not operating that way at Center Spring MD. We are taking care of the whole person, bringing all the pieces of someone's health together, referring when we need to, absolutely, but not referring for every single thing, because so many pieces of health are connected together, just like this conversation we've had today about brain health, autism, weight, hormones, and so much more. So come see us at Center Spring MD. We do virtual visits as well, and patients will, chop that up how they want. Some will come in office for the new patient visit, some will do everything virtually, but again, it's just worked out really well for patients from everywhere, so it's exciting. I see someone joining from Turkey. I'm going to be in Turkey at the end of December. I'm so curious about what the weather's like and what you recommend. So our family's actually getting ready for that as we speak. So, all right, we have time probably just for one more, and then we probably need to close it.
Another question from TikTok. We have the question, I read a study that appendectomies impact gut health. Do you have any thoughts on that?
Appendectomies and gut health. So that's a debate. Now, when that appendix is flared up, it needs to come out. Remember, I spent over a decade in the emergency room, saw lots of different issues with appendicitis. No questions asked there, that appendix needs to come out. But if you're not having that particular issue, your appendix is an immune organ, and it does have a way of helping you defend your body in general. So if you can keep it, great. But if it's infected, if it's inflamed, trust me, it needs to come out. Otherwise, that infection spreads to other organs and can actually cost you your life. It's a lot of different cases that I saw in the ER where that exactly happened. All right, I'm going to close this out there. I'm going to get ready to jump on in to my webinar on gut health. You still have time to join the Superwoman Circle, and if there are questions or topics that you have not seen addressed in anything that I'm doing or posting, please DM me and let me know, and we want to make this a community for you. So I will see you guys next Tuesday, unless I see you back in the circle in just a few minutes. Take care.